All right, welcome everyone. This is a training on the Trueblood case settlement agreement and class notice. My name's Kim Mozoff. I'm with Disability Rights Washington.
And I'm Chris Carney from Carney Gillespie ISIT. We are plaintiffs' counsel.
So this training is meant to cover the recent settlement agreement in the Trueblood case. This training is geared at advocates for class members, service providers, and other interested members of the public. We are going to cover a variety of topics in this training. We will talk about the background on the case and how we got to this point in the settlement agreement. We're going to go through the settlement agreement basics. It's quite a long document, but we will talk about the main parts of the settlement and the elements of the agreement. And then we're going to talk about how you can get involved and what class notice is, how you can provide comments on the agreement that the court will hear, what the fairness hearing is, and what happens after the fairness hearing with the legislative push for funding to implement the changes in this agreement.
So the settlement arises out of the case AB by and through Trueblood versus DSHS, commonly referred to as the Trueblood case. It arose out of a years-long pattern of very long delays in providing competency services to people waiting for those services in city and county jails. Historically, I'm sure this audience is well familiar with the weeks and months that class members would wait in county jails to be evaluated for competency, and then further weeks and months waiting to be admitted for restoration to competency. So we brought this case on behalf of class members, which are defined as individuals held in city and county jails awaiting competency services.
So there was a court order from the federal court in 2015 saying that the state had to move people, had to complete evaluations in the jail setting within 14 days, and then within 7 days transfer people for restoration services or inpatient. Unfortunately, despite making efforts, the state has not been able to meet the court's timeline, and the demand for competency evaluation and restoration services has continued to grow and to grow well beyond what was predicted. So in January of 2018, parties decided to work together and look for some creative solutions to the problem. We spent several months in the spring of 2018 talking to stakeholders all over the state about their experiences with the mental health care system and what they saw as problems and solutions.
This slide shows a sample of the groups that we spoke to. You can see that it's very broad. Our interest was to reach out to people who have worked in, been affected by, or have lived experience in the criminal justice and competency services systems. We wanted to talk to a broad enough group of people that we would get different perspectives and make sure that, to the extent possible, the remedies we came up with would work for everyone on this list. And one of the things that we'll want to hear from public defenders in particular is if there are groups of their clients that we've missed. But at any rate, we made every effort to communicate with as many people as we could about the issues that we needed to resolve. Probably many of you watching this heard from us in that process.
So at the end of that process, we took the information we had heard from all of you and others, and we sat down and negotiated a substantive settlement agreement that touches on a variety of topics. It doesn't just talk about adding new beds to the forensic system. It talks about making some significant reforms all along this continuum where people enter the criminal justice system. And it tries to prevent people from entering the criminal justice system whenever possible. So the elements we're going to cover today are competency evaluations, restoration services, crisis triage and diversion supports, education and training, and then workforce development.
For competency evaluations, the problem here is relatively more straightforward once a person becomes engaged with the competency services system. There were simply not enough evaluators to meet demand. And so based on a projection of demand that was undertaken by DSHS, we have agreed on the number of 18 additional forensic evaluators to be hired and strategically located around the state. In addition, the state is implementing, as part of this agreement, a new forensic data system to give us better information about what we should expect for demand going forward, and so that we can hopefully foresee additional increase in demand and keep up with that by supplying additional forensic evaluators.
The second area that settlement agreement touches on is restoration services. So this includes a bunch of different things. Number one, it contemplates changes to the law that would reduce the amount of people ordered into competency restoration services. So the specifics of that are not yet hammered out or made public, but essentially we would be looking to potentially limit, let's say, certain misdemeanors or other crimes, lower level crimes, and take a second look at those cases before they're ordered into restoration services. Currently, there's sort of a list of crimes and they more routinely get sent for restoration, but if it's possible to require a little additional scrutiny on those cases, we're hoping to reduce the number of especially misdemeanor cases ordered to restoration. The settlement agreement also contemplates 2 additional forensic wards opening at Western and Eastern State Hospital. So in that sense, we do talk about just opening more beds. And the agreement also talks about eventually closing the 2 alternative restoration sites, that's Maple Lane and the Yakima facility. So that will not happen immediately, but the agreement does lay out some hard closure dates for both of those facilities.
Continuing with the agreement pertaining to restoration services, the parties have agreed in this settlement to create a position called forensic navigators, which is a new role within the system that is designed to bridge the gap between the silos of resources that are available to our class members and to interface with court personnel and class members to get them into the services they need in as timely a fashion as possible. In addition to what Kim mentioned a minute ago about building new forensic wards, we thought it was very important that rather than just continue to build new places of confinement for these services, that we look at options to provide people with supportive community placements to undergo restoration services in the community instead of in a secure facility. And so the agreement contemplates giving courts the option of ordering criminal defendants into restoration services in supportive housing in the community instead of in Western State Hospital and any of the alternative sites. That includes the idea that residential supports for community-based outpatient competency services will be necessary. In other words, there will be a provision of wraparound services in housing for these class members while they are being restored to competency. The hope is that with many of them, they would never return to incarceration after that point.
The third area, and it's a pretty large area of the settlement agreement, is for crisis triage and diversion supports. What that means is the things that we will try to do that would increase a treatment response to people in crisis and avoidance of unnecessary arrests and jailing for potential class members. So what does that mean? That means increasing the availability of places that a former or potential class member can go for help in a crisis instead of being arrested. And the law in Washington refers to these as crisis triage facilities or crisis stabilization units. But essentially, these are places set up to accept someone who is in a crisis and potentially in lieu of arrest. And then that person can get treatment as opposed to facing arrest and then going to jail. We have to make sure that there's enough of these facilities in targeted areas to serve the need. Currently, there are not, so the agreement contemplates it opening additional beds in these crisis triage facilities. We would be providing short-term housing vouchers for people leaving that system, leaving those facilities. And what that means really are vouchers for things like motels, hotels, very short-term, 2 weeks to 4 weeks for some people who are leaving this system. For others who might need more intensive support and stability, some of whom we call high utilizers, there would be some more intensive housing supports and case management supports as they exit this crisis triage facility.
To go along with the crisis triage supports that we are hoping to develop as part of this settlement, the settlement agreement calls for funding of co-responder programs, meaning that a trained mental health professional will either do ride-alongs or will be available to report to the scene of mental health crises to help officers figure out the best approach to de-escalate a situation with a person in mental health crisis. And we hope that more of those situations will result in a potential class member being diverted to a crisis triage and stabilization center instead of arrested and taken to jail. The idea here, obviously, is to prevent people from getting involved in the criminal justice system at all, if we possibly can, and instead provide them with more appropriate community-based supports to stabilize them and keep them out of hospitals and jails.
So I mentioned high utilizers before. Basically, the state is working to identify a group that is most likely to experience the competency system, meaning most likely to enter in for competency evaluation or restoration within the next 6 months. So these are often people who have cycled in and out of the system quite a bit. So we will identify, through the settlement agreement, identify these high utilizers and then proactively reach out to those people in particular to offer some more intensive services. That would include some intensive case management services to high utilizers and also some pretty intensive housing supports. So case management that focuses on finding and securing housing for high utilizers and helping them stay there. And then a pretty substantial rent subsidy for those people who secure housing for the high utilizers.
In order to help implement these programs, the agreement calls for improvements in education and training for law enforcement and corrections officers. The main purpose here is to help officers learn to identify a person in mental health crisis as opposed to a person who needs to be taken into the criminal justice system, and to know what resources are available to them to seek help, perhaps call in a mobile crisis response, and get a trained professional to help them decide what is the next best step for a person in mental health crisis, with an emphasis on moving toward diversion whenever possible. With jails, in many cases, jails are not aware of or are not implementing booking diversion programs that are available to them, and so this training will help them identify people who are eligible for and in need of those diversion services, and to push to divert people away from jail bookings into community supports. The agreement calls for Disability Rights Washington, in collaboration with law enforcement agencies and peer support specialists, meaning people who have had lived experience of going through this system themselves, to develop guidance and best practices for these programs and to help jails and police departments learn from what we are hoping to build.
So for workforce development, a lot of what we heard from the state and continue to hear is that they find it difficult to open programs, open beds, because they don't have enough staff who are appropriately credentialed or trained and willing and interested in working in those programs. So this section focuses on figuring out what the problem is there and trying to improve the flow of potential employees. It focuses to some extent on peer support specialists. So peers are people with lived experience, and the state currently has a program where you can get a peer certification. There will be new training program under this agreement for people, peers, people with lived experience with mental illness, and specifically with the criminal justice system. So this would be like an additional certification for those people who've been through the forensic mental health system and can help others in their experience. Peers will be trained to assist people going through the competency restoration system or being diverted from jail. And these peers would be employed and work in the services and programs that are described in the settlement agreement.
Continuing the theme of staffing issues, one of the major problems that we've discussed in this area during the settlement agreement process is that we have a shortage of really good information projecting the need for credentialed staff in the mental health system in the state going forward. We are currently seeing the effects of not having a long-term plan, and the agreement contemplates collaboration with the University of Washington and other academic sources in the state to study the need for these staffing positions, similar to the work that will continue with competency evaluators, so that we'll know how many doctors are we going to need in the next 5 years, how many nurses, etc. Then the next step will be working with universities and other academic institutions to encourage more people to work in those fields, to provide specialty certifications where appropriate to fill these positions. In other words, it may not be necessary for a person to have a medical degree to provide some of the services. It may not be necessary for a person to be a social worker. We may be able to fill these positions with other certifications. It may be that degree programs can be created to fill positions that we currently don't have staff for. And so that's more of a long-range plan, but step one is going to be studying the problem to determine what numbers we're going to need to fill these positions over the next decade.
So those are the 5 main substantive areas of the settlement agreement that talk about change and creating new programs. One thing that I do want to mention before we talk about the phased regions is the contempt fines in this case, because I realized that wasn't covered earlier. As many of you may know, the state has been paying some very significant contempt fines since 2016. Those fines are paid to the court. I think it's upwards of $80 million now. This agreement, if the state is complying and is in substantial compliance with this agreement, they will get relief from those. Well, the plan is for them to have some relief from those fines, depending on the court's decision on their substantial compliance. So the money that they have been paying in will potentially stop at some point, and hopefully help incentivize everyone to make sure the settlement agreement is working and that we're implementing everything in it and funding it. As we move forward, the changes in the agreement are not going to roll out all at once everywhere in the state, simply because that's not feasible and likely would not work and probably would be a big disaster. So instead, what we're going to do is roll it out in phases in specific regions. So this slide just lays out the timing and the areas. In phase 1, we're looking at the 2019 to 2021 biennium for the state budget. The initial areas will be Southwest Washington region, which is Clark County and Skamania County. The Spokane region, which is the Spokane County, and then a lot of the more rural, less populous counties surrounding it. And then Pierce County, which is one of our highest referring counties in terms of referrals into the competency system. Phase 2 would be the next 2 years, 2021 to 23, and that will focus on implementing these changes in King County. King County is the highest referring county by far. And then phase 3, from 2021, that should say 23 to 25, is a typo, would be a review of what we've done in phase 1 and 2, with the opportunity to sort of expand or modify those programs, to potentially identify and focus efforts in a new region, potentially a high referring region not already covered, or to do some combination of those two.
So how can you be involved? What we are hoping for is for as many of your experiences to benefit the final product of this settlement as possible. There is a period between now and the fairness hearing where the court will issue final approval or disapproval of our settlement, during which we encourage everyone to give us comments on what we've done. As I mentioned earlier, one of the most important things that we are looking for is who have we missed. We've made an effort to reimagine the system in a way that will capture as many people who are potential class members as possible, and either ensure that they are swiftly served within the criminal justice system or preferably divert them away from it. We would really like to hear if we have missed a substantial group of people with the efforts that we are looking for. Following the class notice period, the court will take into account the comments that it has received through the parties and will determine whether or not the settlement agreement is fair and adequate to serve the class. Next step, obviously, then will be convincing the state legislature to fund and implement the settlement agreement. And so we hope to have, by this spring, a pretty good idea of where we stand on that.
So class notice is now, and it goes through the fairness hearing, which is December 11th, and there'll be more information as we complete this training on the fairness hearing. But the class notice period is a time in which additional information and instruction is given to class members and to the public, so advocates, family members, service providers, about this agreement. And then it allows people to submit comments on the agreement. Those comments might be positive, they could be negative, suggestions, any type of feedback. That will then be communicated to the court for their consideration. The way that you can submit comments is listed here on the slide: by mail to Disability Rights Washington at 315 5th Avenue South, Seattle, Washington 98104, by email to Trueblood at dr-wa.org, by phone 206-324-1521 is the main number at DRW, and that accepts collect calls from jails. So please let your family members, your clients know if they're in jail, they can call us. There's also a toll-free line, 1-800-562-2702. And then the website actually has a ton of information about this. It has the class notice documents. It has the actual agreement, the full agreement if you want to read that. It's probably upwards of 60 pages. And it has a summary document that's 4 pages that actually goes through and does, as we've done today, kind of explain and summarize the elements of the agreement. So I would encourage anyone watching this to go to the website if they have questions, to see if those are answered on the website, and if not, to then contact us. The website is, www.disabilityrightswa.org/Trueblood.
As we mentioned earlier, the next step in court is called the fairness hearing. At that point, the court will make a final decision about whether the agreement that we've written is fair, reasonable, and adequate to serve the needs of the class. The hearing is open to the public December 11th, 2018 at 10:30 a.m. at the federal courthouse located in Seattle at 700 Stewart Street. The court will consider comments it receives from people who are interested in the agreement at that time, and we hope to have the agreement approved so that we can move forward.
So we talked about this a little bit, but submitting comments to the agreement is encouraged. Please feel free to review the agreement and let us know what you think, be it positive, negative, and everything in between. We are asking that you submit the written comments to Disability Rights Washington by November 30th, 2018. The fairness hearing is December 11th, but in order for us to process those comments and ensure we can present them to the court, we are asking that they be submitted by the 30th, if at all possible. They can be submitted by mail, email, or other means. You can give us a call and talk with us about it if you want some assistance or advice in how to submit those. And I already ran through the contact information, but that's also listed on this slide.
Here are a few hopefully helpful suggestions for how comments would be most useful to us. Short and sweet. We will probably be receiving a lot of these, and we want to give each of them as much attention as we can. And so the more concise the comments can be, the better. Obviously, we will do our best to work through them in whatever form they come to us. The issues that we are most interested in hearing back from people about are: is it fair? Is this a satisfactory resolution of the claims of the class members? Is it reasonable? Do the solutions that we're proposing make sense? Are they rational? And is it adequate? Does it address the problem at hand? And as I mentioned earlier, one important element of this is, are there potential class members that we are overlooking? Are we missing people? And Kim will explain to you some steps for writing comments.
That actually, I would say, if people would like some assistance in how to format those comments or how to submit them, it's probably best to contact Disability Rights Washington, and we can direct them individually there. I also should mention, I didn't say before, but the website, which is disabilityrightswa.org/Trueblood, actually has a way to just submit the written comment right there. There's a form for that on the website. So after the fairness hearing, hoping, of course, that we get final approval from the judge, what's the next step? The next step is we have to go to the legislature to ask for the changes in the funding that we will need to implement the settlement agreement. So we will be looking to potentially change some laws and certainly to get funding to start and run a lot of those programs that are described in the agreement. So we may be proposing legislation or bills to change the laws, and we certainly will be making funding requests. The funding request will be through the governor's proposed budget, which should be released in December. And that's where you'll find a lot of the details about how much this might cost, at least in the initial phasing. The next legislative session goes from January to March and then potentially beyond, of course, depending on the activities of the legislature. But during those months, we are going to need your help. In order to make these changes and to get the funding that we need to implement the changes in the agreement, the legislature wants to hear from you. We can go and talk to them about the settlement agreement and the case, but certainly that's not nearly as powerful as hearing from people with direct experience in this system, especially people who have potentially been through this system or been close with those who've been through this system. We would encourage you to contact Disability Rights Washington, and I listed the contact information earlier, and that's on a couple of different slides here. But please reach out to us. If you want to get involved, we want to help you do that. Your lived experience, your perspective, and your voice will make a difference here. That's not just for this phase, that will also be for the following phases. So certainly we're focused on the phase 1, and we'll be working really hard from January to March. But for each phase implementation, we will again be going back to the legislature, and we'll love to have your involvement. This is a recorded webinar, so obviously we can't take questions now, but what I would encourage you to do is if you have any questions, go to the Trueblood website. That's at www.disabilityrightswa.org/Trueblood. A lot of your questions might be answered on that website and in the materials available on that website, but if not, please feel free to reach out to DRW by phone, by email, or by mail, and we will get back to you as soon as possible and answer those questions and help you in any way that we can. And our last slide is the contact information, again, as I've listed and is listed throughout this PowerPoint. We really encourage you to reach out to us. If you can't find the information you need on the website, the Trueblood website, please feel free to call us, email us, or write to us. Thanks so much.